never forget the daughter who called me after her mom's hospital stay. She read one line in the nursing notes, patient tolerated procedure, and felt like someone had just shrugged at her worries. She called because that single phrase raised more questions than it answered. I get it. That confusion is exactly why I do this podcast.
Welcome to the show. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. I break down complex medical and legal topics into plain language so you can ask better questions and keep your loved one safe. Let's start simple. Nursing notes are the running record of day-to-day care. Registered nurses write most of them: assessments, vitals, wound checks, medication administration. LPNs chart routine tasks. Nurse practitioners or advanced practice nurses add higher-level assessments and orders. Notes appear as progress notes, flow sheets, MARs, those are medication administration records, and handoff documents. Think of two kinds of entries: quick data, vitals, pain scores, simple checkboxes, and narrative notes that explain what happened and why. The narrative is where context lives. If the checkbox says 98% on 2L, the narrative tells you whether that oxygen level improved, whether the patient felt short of breath, and whether staff tried to wean oxygen later. Shorthand is everywhere, and it's designed to be fast for clinicians. NAD means no acute distress. Usually the patient doesn't look like they're struggling in that moment. Ambulated means they walked. Q4H or Q8H are timing codes. Every 4 hours, every 8 hours. Pick in place tells you there's a central IV. If an abbreviation trips you up, look it up or ask. It's perfectly fine to say, I don't know what that means. Now, a short worked example. Picture a single note you might see in your portal. I'll read the mock entry, then translate it line by line. Date and time show when it was documented. Vitals give a snapshot. Blood pressure, heart rate, respiratory rate, and oxygen saturation on supplemental oxygen. Pain 410 tells you discomfort level. Incision clean means no obvious redness or drainage. Voided 200 ml shows urine output. Ambulated 20 feet with one person assist means the patient walked a short distance but needed help. Tolerated after the oxycodone means no immediate adverse reaction was seen right after the med was given. The plan lines tell staff what to keep doing next. Notice how that short block of text answers several practical questions. Is the patient stable now? Did they urinate? Can they walk? Did they have pain? Did they get pain meds? And how they responded. That's the power of reading notes carefully. Curious. Let's talk about handoffs, when one nurse finishes a shift and another takes over. Handoffs transfer situation, recent changes, safety issues, tasks due, and pending results. Many teams use SBAR, situation, background, assessment, recommendation, to focus the conversation. Bedside handoffs add the patient's voice, so the incoming nurse hears directly about pain control, mobility needs, and preferences. Why does this matter? Gaps in handoffs, a missed lab result, an unrecorded change in mobility can lead to missed meds or overlooked safety risks. Documentation is how clinicians who weren't there learn what happened. If the note doesn't match what you saw, bring it up. Correcting the record helps keep everyone safer. Quick role play to make this feel doable. The note says tolerated the procedure. Does that mean it's safe now? Good question. That entry means no immediate reaction was seen during or right after the procedure. To know what to watch for at home, ask what delayed complications might look like and whether any follow-up is required. Try that exact phrasing. It works in clinics and at bedside. A few concrete urgency cues that should prompt a call or emergency care. New chest pain, sudden severe shortness of breath, sudden confusion or slurred speech, new weakness on one side, or signs of infection with fever and spreading redness around a wound. For vitals, persistent high fever, roughly over 103 degrees Fahrenheit, 39.4 degrees Celsius, or oxygen saturations consistently below about 92. How do you access notes? Start with your patient portal, tabs labeled Visits, Health Record, or Documents. If something's missing, contact medical records or the front desk and ask for an electronic copy. Before appointments, highlight the most recent notes and bring 2 or 3 specific questions, changes in symptoms, new meds, or anything you want clarified. Scripts that get results. I saw in the nursing note that X happened. Can you explain what that means for the plan? The note says the patient tolerated the procedure. What should I watch for at home? For corrections, I think this entry is inaccurate. Can we amend it? I've brought my notes. The word amendment signals the formal records process and usually gets the right attention. Your rights. You can view and receive copies of your records, and you can request an amendment if something is incorrect. Facilities have formal processes, a written request, a review period, and an official response. If a correction is denied, you can add a statement of disagreement. If documentation errors contributed to real harm, involve a patient advocate or seek legal advice.
Let's end with 3 practical takeaways you can use tomorrow. 1. How to read notes. Start with dates and the most recent entries, then scan vitals, medications, and any plan language. 2. 3 questions to ask clinicians. What exactly does that entry mean? Does this change today's plan or my discharge plan? And can this be corrected or clarified in the chart? 3. Steps to request corrections. Find Health Information Management. Submit a written request. Keep copies and follow up.
If one last piece of advice helps, treat your chart like a conversation you're invited into. You don't need medical training to point out discrepancies or to ask what a phrase means. Clear documentation protects patients and clinicians alike. When notes are accurate and understandable, care is safer.
If you'd like a printable checklist for reviewing notes before appointments, or the mock note template I read today, visit FAQ by NurseJessicaConsulting.com to download resources or schedule a consultation. I work with attorneys, organizations, and professionals who need clear medical insight in complex cases.
If this episode helped you decode nursing notes or feel more confident asking clinicians questions, please subscribe so you don't miss future practical episodes. Share it with a friend or family member who could use these skills. Until next time, stay informed, stay compassionate, and always put safety first.